Hello, everyone, and welcome to our latest Uncomfortable Conversation. I'm delighted to have with me Niti Patel today here from NHS Digital, who is going to talk to us about her lived experience with endometriosis. Now, Uncomfortable Conversations are where I sit down with somebody who has some form of lived experience or difference, whether that's disability, gender, ethnicity, or any other reason why they are not always treated with the respect and dignity that they deserve. So we're going to talk to Niti about her experience of endometriosis, diagnosis, treatment, and how her work helps her to stay safe and sane. Niti, welcome very much to this conversation.
Thank you very much, Claire. Thank you for having me. So I'll just give a little introduction to who I am, if that's okay. So my name's Niti Patel. I work in the service design and transition team in life services. I'm 40 years old. I'm happily married and have a 9-year-old son called Nico. I was, sorry, to clear my throat. I was diagnosed with multiple sclerosis back in 2013, and last year of February, I was diagnosed with endometriosis. So I just feel it's important to raise a little bit of awareness about endometriosis.
Absolutely. And I expect there's a lot of people out there who don't really know much about it. Maybe they've heard the term, maybe not. So can you give us a little background on what endometriosis is and what it affects?
I can. So I actually didn't know anything about endometriosis until I was diagnosed, and I'll tell you a little bit about that story later. So basically, it's when cells that are found in your lining of the womb and uterus grow elsewhere, and it can cause inflammation, it can cause chronic pain, scar tissue, and it's really misunderstood disease. People think that there's a cure for it. There's no cure. It can affect women of any age. It's a long-term condition, so I'm just learning to live with it.
Absolutely. And, we see in the news statistics about 1 in 10 people with female sex organs having endometriosis. And yet so few of us actually know much about it, and especially until we get diagnosed.
Exactly.
So, and I imagine getting diagnosed must have been quite difficult given that you already had another condition that could have caused some of the symptoms that you were having.
Yes. So with MS, I used to blame everything. Any new symptom I'd get, I'd be like, oh, it's my MS, it's fine, I'll deal with it. But I was getting really painful period pains. But even when I wasn't on my period, really painful backache. Period would be really light, but the pain would be excruciating. And so I knew something wasn't quite right. So I went to my doctor and they're just like, no, just take paracetamol, it's fine. But you know your body, you know something's not quite right. And I was getting other things like my stomach would bloat. And when I say bloat, I would look like 7, 8 months pregnant. Now I know it's called endo belly, but at the time I didn't know that. So bloating was something I was experiencing. And another thing was just like, I've had a baby, so I know what labor feels like. Contractions. I was just experiencing constant contraction pain, and I knew that was not normal. And when I went to see the consultant, I explained it like there's a ferret running around my abdomen, and I still get that feeling now, and it's kind of a part of me. But because of COVID, I didn't go via the NHS route, and thankfully my husband has private medical insurance, so we went down that route. So it was getting a couple of consultants appointments. I was told I had a hernia because I'd had a hernia in the past. So I went with it. I thought, okay, maybe that's correct because the pain was bad then. And they said, Mrs. Patel, you need surgery as soon as possible, emergency surgery. So I packed my suitcase, went to St. James's all ready for my surgery. And then the consultant was like, we just need to do a scan so we know where the hernia is. We know where we're going to operate. So I was like, okay, fine. Had the scan and they said, there's no hernia there. So I was really confused. You know, when you're all like ready to have the surgery, you've got an answer, you know what's going to happen. I went home in tears because there's no hernia. So I was thinking, why am I in pain? What's happening? So then my husband said, let's go back, see another consultant. The number of examinations I had, the number of scans I had, it's like leaving your dignity at the door because you're lying there with your legs open, everyone's poking you, couldn't find anything, yet the pain was still there. So then I saw another consultant, just getting another opinion, and this lady was so nice. She said, why don't we get a diagnostic laparoscopy done? So for those of you who don't know what that is, it's just a surgery under general anaesthesia, make an incision at your navel, one at the pelvis, stick a camera in and do a little bit of investigation. And I remember being in the recovery room and under general anaesthetic, so you're coming out of it really groggy. And I knew whatever the consultant was going to tell me, I wouldn't remember because my memory's rubbish anyway. And with drugs as well, you're not going to remember anything. So I had my notebook and pen ready to write everything down. And I still can vision it in my head. She came in all happy with loads of photos in her hand. Mrs. Patel, we've got a diagnosis. I know what's wrong with you. And she's like, you've got endometriosis. I didn't know what that was, so wrote it down. She's like, you've got stage 4 endometriosis. Didn't know what that was, wrote it down. She showed me the photos, and it was really graphic pictures of my womb, my ovaries, my fallopian tubes, all black. It was quite horrendous to look at. And she said they couldn't remove anything because if they had tried, they would have damaged my organs. So at least I had an answer. So I was relieved, just like a sigh of relief. But then at the same time, I felt really sad because obviously I had my MS and now I've got something called endometriosis. Don't know what that is. So I went home. Google is your best friend. Started Googling. Sometimes it's good. In this case, it was because I had to learn what it was. But if you Google too much, it's not a good thing. So yes, that was my diagnosis.
That's quite a journey that you had to go on to get your diagnosis.
Yes.
And
but I was lucky.
Yeah.
Because I was diagnosed within 4 months. That's really quick. I've joined endometriosis support groups, met ladies who have been diagnosed, and it's taken 8, 10 years, 15 years for somebody. So in my case, I was very, very lucky.
Wow. So they told you that you had endometriosis. They told you it was stage 4.
Yeah.
What does that actually mean? What is stage 4 endometriosis?
So stage 4 is the most severe. So that's when you get loads of scarring, really bad inflammation. You can get cysts. So it's the worst of the worst. So treatment was needed for it, basically.
Right. And that must have been really affecting your work and your home life, I'm guessing.
It was, because the pain was there, it's constant. So obviously it's there all the time. But what I found was keeping busy got me through it. If you take your mind off something, you're focused on something else. And it'd be towards the end of the day where I'd stop working, I'd finish cooking, put my son to bed, and I'd just be sitting there. Then it hit me.
Right. So what kind of treatments are there then for stage 4 endometriosis?
Okay, so initially I was offered pain relief. I'm very anti-meds. With my MS, I don't really take any medication because I like to be mentally strong. But I actually found that MS is a walk in the park compared to endometriosis. So painful. So I had to give in, go to my consultant and say, yes, please give me some drugs. So I tried painkillers, but as you know, there's symptoms with endometriosis, which I've not really covered, but I can do.
Please do.
So some of the symptoms that I experience: lower back pain, pelvic pain, bloating, bladder and bowel issues, bleeding. So there's so much going on there. It's not the same for everybody. So just because I'm saying I've got all this doesn't mean that everybody has it. Everyone's different. But yeah, so I had to have something to help with all this chronic pain I was going through. So I tried the painkillers, but as you know, with the symptoms, you get side effects of the medication. So obviously I've got my son, I'm working full time, have to drive to do the school run. It wasn't working for me because I'd rather be off the drugs and be fully sane and know what I'm doing. So I went back to the consultant. So she said we can try injections, hormone injections. I'm terrified of needles, but anything's worth a try if it's going to help. So I tried that. There was one injection every month for 3 months in the stomach, and oh my God, it was very, very painful. But it worked maybe for a couple of days, and then the pain was back with a vengeance again. So I was really unhappy, and my husband could see it. I'd be miserable, I'd be crying. Obviously, when I was at work, I had my smiley face on because I'd had my work hat on, but out of work, I was very miserable. So I went back to the consultant. So she said, there's a final avenue we can go down, which is surgery. So I was like, okay, tell me more. So I agreed to have a hysterectomy. So that took place last summer.
Right. Gosh, so that's really major surgery to have to go through.
Yes.
And did it work? Has it affected your symptoms?
So the surgery entailed being in hospital for a few nights, and the surgery I had was I've written it down because it's a mouthful. It's called a total abdominal hysterectomy and bilateral salpingo oophorectomy. So that means basically the cervix, the uterus, the tubes and ovaries are all gone. Really major surgery. I still remember sitting there in the hospital room on the chair, had my catheter in, because they force you to get out of bed pretty much straight away to walk, and the pain. I was just like, why have I put myself through this? But it was worth it because the pain did subside for a little bit. But like I said, with endometriosis, there is no cure. It's always going to be there. And then August time, the pain started to come back again. So
Oh,
like I said
gosh.
before, you know, that ferret that I said was running around my abdomen, that ferret is there all the time now. So it's like a part of me. It's really strange.
So
It's just an
even
ongoing
with the
thing.
hysterectomy, right? So even with the hysterectomy, it's still left you with a lot of symptoms.
It has, but that's not the case for everybody. That's just me. It could work for other people.
Hmm.
So I don't want people to think, oh, I'm not going to have a hysterectomy because it's not going to help me, because it might help other people.
Yeah. And I guess having had such a complete hysterectomy with no ovaries and so on, you must have had to go through surgical menopause as
Yep,
well.
straight after, because the ovaries are out, surgical menopause kicked in, and it was an emotional roller coaster. I think I cried every day for weeks and weeks because your hormones are everywhere, emotions are everywhere. And I was warned about it, and you just say, yeah, I'll be fine. But when you actually go through it, it's just like, it was really difficult. But I was really lucky. I had really good support from friends and family, and even my work family, everyone checking in on me, which really helped. So then obviously surgical menopause, you go on to hormone replacement therapy, HRT.
Right.
So one of the symptoms of menopause is brain fog, and that brain fog is part of MS too. So I'm foggy all the time. And I was given HRT gel to apply. So it's a gel that you'd apply on your thighs every morning at the same time. And I'd forget to apply it because my memory's rubbish. And I'd put a reminder on my phone and an alarm would go off. But I'd just like snooze it or dismiss it, but I wouldn't apply the gel. And you could see the difference. I'd be 1 minute I'd be really happy and nice and loving, and the next minute I'm an Aries as well, so I'm really fiery. The dragon in me would come out. I'd be roaring. I'd be moody. So even my husband and son now know. Like even yesterday, my husband was like, "Do you need nitty time?" I was like, "Yes, I need nitty time." So the HRT gel didn't work basically. So I went back to the consultant, said I need something else. So they've put me on patches now, which really does help.
Oh, that's great to
Night
hear.
sweats at bay and mood swings are at bay. So
Yeah.
yes,
And your husband and son obviously very supportive.
very
But
supportive. Yes,
I imagine they're
lucky.
they're they're glad to know that you're on a more even keel.
Yes.
Yeah.
But don't get me wrong, it's still hard. I have my off days where I do cry every single day, but it's just a form of offloading because you have to
Yes.
get it out of your system, and that's okay to do, I
Of
think.
course. If it works for you, then it is.
Yes.
Yeah. Well, and you shared that your work team have obviously been really supportive.
Yes.
What have
Really
they been doing
supportive.
to keep
So
you going?
when I've been off work, so for the hysterectomy, I was off work for 3 months, and people would check in on me. I'm no lie, every single day there'd be someone seeing how I am. And even when I came back to work, I was put on a phased return, only did what I could do. Just really supportive all the time. Even I'm back full time, workload's really busy. Those of you know the service design and transition team, the workload we have is immense, but that's what keeps me going. I love the stress and I love being busy, but the whole team, not just my team, but NHS Digital as a whole, are really supportive. So I'm very, very lucky.
That's wonderful. And I know that the service team do such an amazing job, and yes, you definitely have a lot on your plate, all of you.
We do.
Yeah. Well, thank you very much for sharing your experiences, Niti. We really appreciate you taking the time and being so open with us about what the effects are.
My
I
pleasure.
certainly understand more. Yeah, and I'm sure that many other people do. So thank you again, Niti, for taking the time and giving us such an incredible insight into your life. We wish you every happiness and that you are able to continue doing the amazing job I know you do at NHS Digital.
Thank you very much, Claire.
Thanks.